I knew there was something drastically wrong. When I came back from holiday, my doctor sent me for a colposcopy at the local hospital. He took the colposcopy, and as he was doing this, he called the nurse over to look at the screen and advised the nurse of what he could see. I didn't know what he could see, but he then advised me it would be taking a biopsy. So he took the biopsy, and which I have to say I didn't feel any pain, and then he asked me to go straight back into his office to go and see him. So I got dressed, went back into his office, still not suspecting anything sinister. I sat before his desk, and he told me that I had cervical cancer, and we didn't have to wait 3 weeks for the results. We had to work now.
I think the team at the hospital I went to were all very supportive and openly communicative. We had open, honest discussions, and I think that was really important because we all knew they knew what I felt, I knew what they wanted to do and how they felt. And we were just able to talk openly about everything, treatments, diagnosis.
When I went up for the planning day, the nurses up there were great. They really were, and they told me about sort of things I should do or shouldn't do, as the case may be. And I asked them what I should tell my children, and they said, "Well, how old are they?" And I said, "Well, the younger two are 4 and 5, and the eldest one's 16." And she said, "Well, what do you want to tell them?" And I said, "I'd like to tell them a little bit, because obviously I'm going to be disappearing every day to come up for my radiotherapy treatment, and later on I'm going to have some surgery." And at that stage they said hysterectomy, but I really wasn't quite sure exactly what that entailed. And she said, "Well, for the younger two, just answer their questions, just tell them that you've got to have that you've got something wrong with your tummy, and you've got to the doctor said that you need to have some treatment at the hospital, something done at the hospital to make it better." And I said, "Will that be enough?" And they said, "At that age, that's probably as much as they need to know. And if they want to know more, they will ask." And as it happened, that was quite a good bit of advice. You don't need to go into all the ins and outs with very young children. If they need to know more, they will ask.
I suppose, if a woman's looking at this site because she's just been told she's got cervical cancer, I think what I would say to them is it's definitely not a death sentence. If they've caught it now, and you're going to go in for the treatment and everything, then the chances are that in a year's time you'll feel exactly the same way as I do now. That it was something that happened. It was a part of your life, but it's not. It's over. It's done with, and get on with the rest of your life.